doctors can be awful sometimes. Like, I respect them a lot. To the matter of fact, it was my dream to become a doctor all my life. That's what I wanted to do. Like, I thought I wanted to do, at least. But there is a new term that's being coined called medical abuse or medical violence. And I don't want to be one of the advocates for like fighting the system and say, oh, the doctors are evil, the patients are good. Not at all. What I'm trying to do every day I wake up in the morning is actually to bring these two parts together. I'm working with nurses and medical students and doctors and patients. And I have my patient school, which also teaches doctors. We want to communicate better. Otherwise, we would not be able to make it together in this health journey, right? But yes, I don't think doctors understand the responsibility, the sheer, huge responsibility they have in their hands and on their shoulders when they are talking to patients. I've been trained as a teacher in a very unique program in the Israeli Democratic Institute. And since it emphasizes on democratic and progressive education, what you do as a teacher for your 4-year training is basically to get to know yourself first. You cannot walk into a classroom biased, angry, undeveloped. You cannot just tell a student something that will affect his life forever. And to the matter of fact, I know people who are still traumatized by things teachers told them 20, 30 years ago. So in order to train teachers better, we have underwent personal psychotherapy, group therapy, group development, personal development. So the first year you just map your own challenges and then you try to address them. And the aim of it is that you end up being a very conscious, mindful teacher. Why can't we train our doctors in the same way? I've been preaching about it. I've been advocating for it for years. And yes, there are some universities like the Tel Aviv University that has medical communication courses in which patients must meet doctors and doctors must meet patients in order to communicate. And the medical students, actually, it's mandatory for them to mentor or be mentored by students. I'm going to do it again. It's mandatory for medical students in the first year to meet a patient for the entirety of one semester and get to know their issues, go with them to see other doctors and to undergo admissions and examinations of sort, because the Tel Aviv University decided, hey, we want our future doctors to know how it's like to be in the patient's shoes. And when I'm talking about responsibility again, and I'm talking about the consciousness and the mindfulness doctors have to exert, I think that doctors need to be trained better. Of course, they need to learn better nutrition and bedside manners and psychology, but basically, doctors are not only the people who prescribe stuff for us. Doctors are guides, educators, great pillars of our community, and they are someone or someones we trust. And if this trust is violated, we as patients can be severely impacted and traumatized. And yes, I've been encountering awful doctors that maybe they were biased, maybe they had a fight with their spouse or I don't know what, but they took it out on me as a patient. They didn't let me feel that I have control over my body, future decisions. I will talk later in other videos about some horror stories I have from healthcare in which doctors told me I will never walk again, never work again, that nothing will never going to come out of me, that doctors gave me no hope and actually sent me to a very grim future. So yes, doctors can be awful sometimes, but we need to understand the stress and pressures they're undergoing. Sometimes they have 5 minutes for us, sometimes they cannot sleep for 25 or 30 hours. We need, like any other narrative-based communication and violence-less communications, we need to understand the other side. The people who treat us, they don't choose it because they just want to have this nice shiny stethoscope. They are in for the long run. They want to help people. And yes, People can get corrupted along the way, not financially necessarily, but due to the stresses of the system, and get dull and get numb. And one of my purposes in life is to work on that and prevent it from happening. So doctors can be awful, but doctors can be amazing. It can be angelic and can really help us. So I think that with better education, better communication, and better responsibility understanding the huge responsibility both sides have, that we are playing a role and the patient also have responsibility, and this is not a one-sided game, we can make things better for both sides.